Hello, I'm Robin Koval, CEO and President of Truth Initiative, the nation's largest public health organization dedicated to achieving a culture where young people reject smoking, vaping, and nicotine, and a future where commercial tobacco use is a thing of the past. It's my pleasure to welcome you to today's Truth Initiative Impact Series, Gamechanger, shifting from tobacco control to ending the industry's influence for good. Today, smoking is still the leading cause of preventable death in the US and globally. At the same time, the persistent youth e-cigarette crisis is putting a new generation at risk for a lifetime of nicotine addiction. Truth Initiative is committed to elevating and advancing the conversation about how we address tobacco in our country and shifting the mindset from one that assumes tobacco's continued long-term presence to one where society rejects its use entirely. In other words, moving beyond tobacco control to the natural end of tobacco, its harmful impacts, and the influence of the tobacco industry. For the purposes of today's conversation, we're going to use the term endgame to describe this set of objectives and future state. We know various groups use different terms, and sometimes endgame means different things for different people. But for today, when we say endgame, what we're talking about is strategies to move to a time when commercial tobacco and nicotine, with the exception of FDA-approved medicines, are no longer desired or used. This objective is rapidly growing acceptance, including by the majority of American people, 57% of whom said they would like to see tobacco ended in the United States, according to the latest data from CDC. As part of today's discussion, we're eager to explore how we can work to achieve this tobacco-free future through policies that make products harder to access, less appealing, and less addictive, increasing cessation interventions and services, and denormalizing tobacco use in our culture. To that end, Truth Initiative has authored a policy paper which discusses our point of view to make the tobacco endgame a reality. We know how important moving towards endgame is for so many. Current tobacco policies have left large populations behind, and this shift is an opportunity to advance health equity and end the health disparities tobacco creates in our country. And so now I'm pleased to introduce our moderator for today's discussion, Dr. Ruth Malone. Dr. Malone is internationally known for her research and analysis on the policy and dynamics of tobacco control and is published widely on tobacco endgame. In fact, she first used the term endgame in a 2010 editorial. She's the current editor-in-chief of the leading international policy journal, Tobacco Control, and continues to serve as a leading voice on this issue. So truly, there's no one better to lead this discussion today than Dr. Malone. And so with that, I'm happy to turn it over to you, Ruth. Please take it away.
Thank you, Robin. I think it's very exciting to be here as part of this panel today. And as Robin mentioned, Endgame has been a global conversation that has gained traction in many places all over the world. So before we begin our live panel, I want to introduce a special speaker, Dr. Janet Hook, a great colleague of mine and professor of public health at the University of Otago in New Zealand. New Zealand has recently undertaken world-changing tobacco endgame related policies, a set of policies that includes reducing the number of tobacco retailers by 95% to no more than about 600 in the entire country, capping nicotine levels in combustible tobacco products, and disallowing the commercial sale of tobacco products, combustible tobacco products, to anyone born on or after January 1st, 2009. With the aim to reach a tobacco endgame by 2025, a smoke-free 2025. So we're very excited. She's a co-director of the Aspire Center in New Zealand, and her current work examines several endgame policy options. So I'm really happy that we are going to have a little introduction from her.
Well, thank you for that very warm welcome and introduction, Ruth. It's a great pleasure to share experiences from Aotearoa, New Zealand, where, as you've said, our government has recently enacted legislation that will do three things. First, it's going to greatly reduce tobacco availability. The number of stores selling smoked tobacco will decrease from around 6,000 to 600, and that will take effect in July next year. It will make it easier for people to quit and harder for young people to start smoking. Second, it's going to make tobacco essentially non-addictive by setting a new maximum nicotine standard, and that will take effect from April 2025. And the final measure is introducing a smoke-free generation, and that will complete the reframing of tobacco from an ordinary consumer product and recognise it for what it is, a highly toxic substance that's killed millions of people. As always with policy innovations, there's a bit of a backstory, and I want to acknowledge the role that Māori leaders have played in creating the Endgame vision that we're about to see realised in Aotearoa. Their determination to end the harms commercial tobacco has imposed on their whānau and their communities was pivotal in transforming our thinking and in sustaining momentum over the 10 long years between the government announcing the goal and actually developing an action plan. Although the vision has always been clear, the pathway has had some bumps. Tobacco companies have claimed they want to end sales of smoked tobacco as part of the corporate transformation they're apparently undertaking. However, they've opposed these measures, claimed they will lead to a rampant black market, despite evidence suggesting that's unlikely to be the case. And bizarrely, they've argued these new measures will curtail freedoms. We need to be quite clear. The policies will end the devastation of addiction, and they will create freedoms. The measures will help people who smoke realise the dream the vast majority of them have, and that is of becoming smoke-free. Modelling studies estimate the measures, particularly de-nicotinisation, will bring about rapid reductions in smoking and, very importantly, end inequities in smoking prevalence. We hope the progress we've made will inspire other nations and that our approach will be helpful. If I can offer some advice, develop strong partnerships, particularly with Indigenous peoples, whose experiences and vision will be crucial. Make sure their voices are heard, respected, and acted upon. Recognise and support your champions. Keep developing and testing the evidence that they and your policymakers will need. And if I can borrow some of Ruth's sage advice, always keep imagining things otherwise. We can and we must move beyond tobacco control to endgame thinking. Thanks so much for allowing me to join with you today, and best wishes for a very productive panel discussion. Back to you now, Ruth, to introduce the panel.
Thanks for those kind words. I'm always pleased when my sage advice is taken to heart. And so I'm really happy now to introduce our panel. I'm going to go quickly. I could go on and on about each of them, but we have so much to cover and not enough time. And it's such an exciting topic. First, of course, as we all know, Robin Koval has been leading the Truth Initiative since 2013 and has done a fabulous job with the highly effective Truth campaign that has driven down youth smoking rates to historic lows and has now pivoted to take on all the multitude of other products that the industry is now producing in its efforts to stay alive. Eric Lindblom is a senior scholar at the O'Neill Institute at Georgetown in Washington, D.C., and an independent consultant on legal and policy matters with long experience in tobacco regulatory policy. Chris Bostic is policy director at Action on Smoking and Health in again in Washington, D.C., has been working on endgame policies at local, state, national, and global levels for quite a long time now, and is engaged in human rights work globally that involves endgame discussions. Mark Gottlieb is executive director of the Public Health Advocacy Institute in Boston, where he has long worked on public health, tobacco litigation as a public health strategy, and teaches public health advocacy. We also have Stacy Gagosian, who is vice president of public policy at the Truth Initiative, where she brings more than 20 years of work in politics and policy. Finally, we have an additional panelist who wasn't able to join us for our live discussion, who we'll hear from later on. Natasha Phelps, who is Director of Equity-Centered Policy at the Center for Black Health and Equity in Washington, D.C., and has been working for many years directing the organization's work on policy at local, state, and federal levels, and really has a focus on the equity issues that we have to address if we really are going to achieve a tobacco endgame. We'll hear from Natasha after our live panel. So I'd like to welcome all our panel, and I think I'll start with a question for Robin to start us off. Can you say a little bit more about making the distinction between tobacco control, which we've been doing for decades, and tobacco endgame, which we realize there may not be one definition of endgame, but why is this pivot important? What is happening?
Well, thanks for that, Ruth. I think it's very important for us to reframe our thinking, reframe the conversation from one where we are attempting to control tobacco, which assumes that it will always be with us and maybe even should always be with us, to one where we really start thinking more from the perspective of how do we end the influences and impact and bring us to a natural end to this epidemic, which is really what Endgame is about, regardless of which words you use to actually label it. And I think, it's important because it helps us to envision this as a very achievable goal. If you think back to the past of, now we go into restaurants in most places. Many places still don't have complete clean air protections yet. But for a lot of people, you wouldn't think of seeing smoking in a restaurant or being able to smoke in certain spaces. And at one point, that was thought unthinkable. How are you ever going to do that? And so I think reframing this conversation to tobacco endgame is a way of saying to ourselves that we are not always going to try to just control tobacco, but that we are actually looking to an achievable, realistic end, and making tobacco less appealing, less accessible, less addictive, less affordable. And that is the way we will reach this natural and frankly much needed end to the tobacco epidemic in our country.
Thank you, Robin. I do think that it's really about a vision of the possible, and I think for a long time many people have just assumed it was impossible, and some still do. Now, that's not to say there aren't obstacles. And Eric, I wonder if you could talk a little bit about the overcoming the obstacles that we still have in the way of actually achieving an end game.
Well, it's really a sorry history when you look back at what's been going on. We've known since the 1950s and on about how addictive and how harmful smoking is and other kinds of tobacco use, how it's addictive, it's getting kids addicted. We've learned more and more and more about the just extraordinary death, disease, disability caused by smoking and other tobacco use. We haven't done enough about it ever. And what's really wonderful about the endgame discussion is it's reinvigorating, I think, the tobacco control community, the public health community, and waking up a lot of policymakers and regulators about how important this work is to get done. But the main obstacle has always been a lack of political will. And one big problem is just enormous political opposition by the tobacco industry. They talk a good game now, some of them, talking about how they want their smoking customers to quit all use, or if they can't do that, switch to non-smoked tobacco products. But we haven't seen them back that up by supporting strong anti-smoking measures or various public policies that would make that happen. They continue to oppose it like crazy. But there's also a view, I think, that you alluded to, that many people think it can't be done, or they think that the problem is already taking care of itself, because we've seen declines in adult smoking and overall consumption. And I think that what's wonderful about Endgame, again, is it's waking people up that we can do this. We know how to do it, and we can get it done. And I think the main obstacle, is for the, one obstacle is also the public health community. We have divisions in the public health community with arguments about subsidiary, secondary issues like harm reduction, e-cigarette regulation, and so on, instead of really focusing and getting a strong, publicly advocated, a consensus public health message about these are the 3 or 4 absolute top priorities to trivialize smoking, protect kids, and otherwise reduce tobacco death, harms, disability, and costs as quickly as possible. And I think we have a lot of hope for doing that now, because people, it's a double-edged sword. People think the problem is going away, but since it's so small now, some people think, or centered in less disadvantaged non-voting populations in the U.S., for example, that finally we can actually implement these strong policies despite all that opposition from the tobacco industry.
I think you touched on an element that I do want to loop back to, which is the equity concerns in Endgame, and the fact that we want to be sure that everybody comes along as we move towards Endgame. And we know that smoking is now much more prevalent in populations that have various other forms of social disadvantage. And we actually, this is part of a focus that we certainly have in California. Chris, I wanted to turn to you now because I know you've been doing work not only globally, but also in California. And I wonder if you could say a little bit more about the status of California's Endgame initiatives and how equity is integrated into those, and maybe also touch on some of the global work you've been doing.
Sure, I'm very happy to. California is where the action is right now. They're a very healthy competition with New Zealand, I think, and they're taking 2 different approaches, and we're going to learn a lot from both as they move forward. I think what's somewhat unique about California is that this is coming from the government. It isn't an advocacy-driven, although the advocates are certainly involved. It's the California Department of Public Health's California Tobacco Prevention Program that is really running the show here. And I want to point out that that name has recently changed. Until about a month ago, it was the California Tobacco Control Program. But they had decided to get rid of that word control. And having a government agency do that, I think, speaks loudly about where we're going with Endgame. But a couple of things about California that I'm really impressed with. The first is that health equity is absolutely paramount. And they have set a goal, a prevalence goal of 1.9%. People determine what Endgame is by various measures. And they have a very low 1.9% as their goal. But they will consider themselves a failure if any individual group of people, any community, disadvantaged community, doesn't reach 1.9%.
And just to be a little more specific, policies that are moving ahead in California include banning all flavors in tobacco products, banning sales in some instances, further restricting retail availability through multiple different policies. And that's a big piece of New Zealand as well. And I think in terms of talking about helping people quit, we started having this conversation about why do we put the whole burden of quitting an addictive product just on these individuals? While it's still being promoted like it's milk and bread at the corner store. It just makes it so much harder for people. We should help them by making it easier for them to stay away from it, easier for them to say no to it. Another policy approach that I know Mark has had a lot of involvement with was done in Brookline, Massachusetts. And Mark, I wonder if you want to talk about that, the tobacco-free generation policy that you helped with there.
Sure, yeah. The tobacco free generation policy, also known as the nicotine free generation policy, um, is an endgame strategy that involves a phased in ban of all tobacco sales. Um, and it's phased in around a universal birth date. In the case of Brookline, that date was set as January 1st, 2000. So no one born on or after January 1st, 2000 may purchase any tobacco product in the town of Brookline, which is borders Boston. And in 20, I guess late 2019, a couple of Brookline residents came to me wondering what can we do now? You know, we've Brookline was one of the first to raise the minimum sales age to 21. They eliminated all flavors, including menthol. Those policies became statewide policies not long thereafter. And you know, there's a question as to whether there's any reason why tobacco products should be sold at all in Brookline. But you know, the reality is not everyone is ready for a complete immediate ban on tobacco sales. So the idea was to phase in this ban over time. And so in 2020, the what's called the town meeting, which is the local legislative body, amended the town's tobacco sales law to include this provision. And because of the way things work in Brookline, the state attorney general needs to weigh in to ensure that this local law is not in conflict with the state law. In our case, the concern was the state law that established 21 as the minimum sales age. And that law actually has language in it saying that there should not be other laws passed that are in conflict with that. And the attorney general came back and approved this new bylaw. And that was in July of 2021, and it went into effect, and implementation began in September of 2021. One of the things that we expected was a response from the tobacco industry. In this case, the tobacco retailers of the town of Brookline filed a lawsuit against the town, saying that, well, yeah, the attorney general got it wrong. It is in conflict with the state law. And also, it violates the equal protection rights of these retailers. And my organization, the Public Health Advocacy Institute, had agreed and made an offer to any town that was willing to try this, that we would help defend them if there was a legal challenge. So we've been doing that with Brookline. We had the case against the retailers dismissed. And at this point, it's at the state Supreme Court. And hopefully, once we are successful with this, we'll see other towns in Massachusetts and beyond try to implement this policy as well.
Thank you, Mark. As it just points to the fact that pretty much any innovative policy that might be effective is going to be challenged, likely to be challenged by the tobacco industry. And it's interesting that no challenges as yet have been, no legal challenges as yet have been raised to Beverly Hills or Manhattan Beach in the case of their full sales bans. Now, part of that may be due to the fact that the Tobacco Control Act, the federal act that gave the FDA permission to regulate tobacco products, explicitly mentions that local jurisdictions can regulate the sale of products. They cannot necessarily regulate the manufacturing of the products and that sort of thing. That's FDA's jurisdiction. But local jurisdictions and state jurisdictions, local providing they're not preempted, can do this. So I think many jurisdictions don't realize they can do this either all at once or gradually. There's been some criticism of the tobacco-free generation that it's too slow. It gives them another few decades, to keep on, and doesn't necessarily change the sales environment, which is something that I think is really important.
And Ruth, if I may, I think that is a really great point and illustrates that none of the endgame policies that I think any of us are talking about is a one size fits all policy. And depending on whether a local community even has the legal right, and it varies from state to state, to implement a policy or law like that, or it needs to be done at the state level. It's what the community is ready for, politically and culturally. And if they're not ready, it's not likely to be a successful policy.
Yeah, I think that's absolutely right. I wanted to give Stacy a chance to weigh in here and talk about how these various initiatives relate to what Truth is doing now and its leadership on Endgame.
Sure. Thank you, Ruth. First, I'll just say that I completely agree with Mark that there is no one single policy that's going to work, and communities are going to be in different places along this journey. But it's really important that they be on the journey wherever they are, and that's because the we know from the past and even from Endgame policies that have gone forward so far, local and state initiatives are really the incubators for federal action. And that's why it's so important to see these first cities and jurisdictions out there taking these first steps, so that it gives the federal government confidence that they will work, and the data that the federal government needs. So, for example, the FDA proposed rule to remove menthol in flavored cigars, menthol from cigarettes, and all flavors from cigars, is really critical in many ways. It definitely will impact equity and help alleviate tobacco-related disparities, because we know that there are many groups, but particularly African Americans, who are grossly disproportionately impacted by menthol cigarettes and flavored cigars, for that matter, as well. But other groups as well, the LGBTQ community, and others. So it's really important to get those going. So that's something that Truth Initiative has been working on for many years, and it's also our number one priority when it comes to Endgame. We have recently written our Endgame policy paper, where we have a few policies that we highlight. Again, no one policy is the panacea for Endgame. We're going to have to do a lot of policies here to make this happen. But certainly, menthol is one of the top ones, as well as you've already mentioned, retailer density, reducing the availability of these products, particularly for young people and those who are trying to quit as well, and reducing the level of nicotine in tobacco products is really important as well.
Chris, I think I'd like to just ask you to touch on the public support for Endgame type policies.
We've been kind of blown away by public opinion on this. It was far higher than we initially sort of assumed. It's actually more difficult to convince the public health community than it is to convince individual people. And it makes sense. Everyone's lost somebody from tobacco in their families and their lives. And most people that see this going on wonder why, especially when we ban things like lead paint and asbestos, even lawn darts, but we can't ban this product that's the leading cause of preventable death. But just some of the figures that we've gotten back, we already heard that a CDC poll found 57% of the public was in favor of just ending tobacco sales. There was no wiggle room about it. And that's without any kind of public outreach. We have found that we talked about challenges earlier. One of the biggest challenges we face is not that it's impossible; it's that that's possible at all. It has never occurred to so many people that this is something that we could actually do. But when they're asked, when they're prompted, they do go for it. But in terms of levels of support, just a few examples. Spain had a poll last year asking about the tobacco-free generation concept, and 84% of the people polled said that they would like that to be enacted. That's also consider that Spain has a 22% prevalence rate. So a large number of people who smoke also thought that's a good idea because nobody wants their kids to smoke. France then held a similar poll, and they came back with 84% that wanted to do it there. And no matter how we have asked the question around the world, if they were able to break out the responses and find out who separate people who smoke from people who don't, no matter how we've asked the question, at least a half of people who smoke are in favor of Endgame. And just anecdotally, since we started Project Sunset, which is Ash's Endgame program, we have gotten calls and emails from individuals who smoke begging us to get this done where they live, because they've tried to quit 15 times, but they can't, because every time they walk into a store, it's right in front of them. And everybody knows if you're trying to break an addiction, the first thing you do is get the thing they're addicted to away from them, right? And we had one gentleman who actually lost a foot because of his tobacco use and still could not quit. And he's just, please come to my town and do this. So we have the public on our side. We increasingly have the public health community on our side. Now it really is, as Eric and others have said, about political will. We need to convince decision makers that this is not only the right thing to do, it's the popular thing to do.
I would just add to Chris's statement that we have known for many years that 70% of smokers want to quit. We now know that 60% of young people who use e-cigarettes want to quit. So, Endgame is really advancing a policy that, regardless of the political back and forth, people are telling us they want more help to do. And I think, as you say, Chris, the public wants it. It's really up to those of us who advocate for it, and of course for those in power to enact these policies, to take their cues from the public and do what people are asking for.
I think it's also important that we're not just talking about smokers, but there's a whole generation of young people who became addicted to nicotine from Juul and other flavored e-cigarette products that deliver super high levels of nicotine. And they are stuck, and they're looking for a way out. And we really need to continue to develop best practices and deliver them for these young people so that they don't have to go through their whole lives nicotine dependent and always a customer of the nicotine industry.
It remains really crazy in our society that we have addictive tobacco products sold in well over 500,000 sales outlets, more than there are McDonald's, for example, all the way around the country, and they're all youth accessible. A simple rule that FDA could implement or Congress could pass or other countries could put into effect would simply say you can only sell these products from adult-only sales outlets. And that would do an enormous amount to reduce exposure for kids to not only the product, but their advertising at retail outlets, and also help reduce exposure for adults who are trying to quit and so on. But that's one of the endgame policies. It's just a no-brainer that should be done, but we haven't seen it happen.
Or even better, reducing, the number of outlets altogether.
Yeah, at the same time, right.
And as Ruth said, would say that, this is part of that denormalization process of tobacco sales. You have to go to an adult-only facility to purchase them. That speaks a lot about, how society regards these products as being dangerous. So youth cannot just not access them; they shouldn't be exposed to to them and to any of the promotion or even see these products.
Yeah, I would say, having, worked with young people at Truth Initiative, obviously that's our primary focus, that is an industry narrative that, you will create an illicit trade, that we will make this somehow more appealing to people. That is just not true. And in fact, what we have learned time after time with young people is, when they have the facts that are delivered in a way that's honest and from trusted sources, whether that's the Truth Campaign or through peer related sources, they actually are very open to the facts, interested in sharing them, and the forbidden fruit theory, I think, is one that the industry, just like, they often use the scare tactic of, well, if we remove menthol cigarettes, that will become another way for people of color to be over policed in this country. All that does is conflates two issues. Young people do sometimes silly things and sometimes are, and dangerous things. That does not mean you should not take a product that is dangerous, and addictive, and make it harder for them to access. The same way, you should not conflate the issue of over policing in America with the issue of removing menthol cigarettes. So I think we have to be very, very careful not to let them, use the playbook to create an issue when it's really a distraction.
Yeah, I think, ultimately this really is about a consumer safety issue. It's about, does it really make sense in the 21st century to keep on selling these things everywhere? So, I mean, I, of course, am in agreement with all these comments from the panel. But what about the people who say, well, this is prohibition? This is prohibition, and we know prohibition will never work. What do we say?
Well, I think it's another scare tactic of the industries. First of all, we're not talking about policies that, are pointed against consumers of these products. These are all policies that are about the entities that manufacture and distribute, and sell these products. So that's an important point. I think the other thing that's often confused here is, prohibition, the old, 1920s alcohol prohibition in the United States was a law that was enacted on a date, and all alcohol was removed from the market, or was supposed to be removed from the market on a specific date. And that is the point of, exactly not the point of what we're talking about in Endgame, which is creating readiness in communities. So when people want it, having these policies enacted so that the community is ready and willing to accept it, which is very different than prohibition. And that not all of these policies will go into effect, on the same date at the same time.
I would just add that the rhetoric around prohibition is very powerful, and it's something we all have to reckon with. It, in fact, I think was the main reason why health advocates up until recently were afraid to even consider endgame strategies. And it took someone coining the term and publishing it in the literature about 13 years ago to give us the vocabulary to begin this conversation, Dr. Malone.
Well, thank you for the credit. I think, Eric, you wanted to jump in with something.
Yeah, on prohibition, first of all, I think we should push really, really strongly for nationwide federal action. I don't think we should rely just on state and local. We don't need more information on a lot of things. I mean, if FDA did what it says it wants to do, and we're able to do that with proper White House support, we'd have a ban on all flavors, added flavors for all tobacco products. We'd have nicotine taken to non-addictive levels in cigarettes and other smoked tobacco products. They could restrict sales to only adult-only venues and take various other actions if they could actually implement some rules. All of those are proven strong measures that would be revolutionary. They would so dramatically reduce harms, youth use, everything else in the U.S. And still, adults would be able to legally, who are already addicted, would be able to legally obtain e-cigarettes, for example, to still continue inhaling nicotine into their lungs. So again, it's not prohibition. Even if you did the top 5 or 6 endgame proposals that are floating around, it still leaves a way for addicted adults for at least a certain time period for years to obtain some kind of legally available product. So prohibition really isn't an issue yet at all, and is not on the near horizon.
Well, and I think the relationship that product users have with the product is probably somewhat different as well, since we know that 70% of the people that use the product don't really want to be using the product. That's pretty, and that's been so consistent over so many years. So I think, I think one thing that's really, and I agree with you, it would be great to have this federal action around, and you would think that in an era of a cancer moonshot, that maybe something like this would be on the priority list. So it's kind of astonishing that it's not, that it's such a blind spot. But I think this speaks to why we need a different way to view this, is that it is a blind spot. People just assume it can't be done because there are too many things that we either don't know about how it would work or wouldn't work, or we just haven't ever said, okay, this is where we want to go. And now we'll backtrack from there and see what we need to do and try to get there. It's always just been off the table. And I think the important thing is to begin to say, no, it's not off the table anymore. We are really going to do something about this industrially produced epidemic that has devastated the lives of so many people around the world.
Just on the cancer moonshot and the relationship to tobacco control, that is the way we need to think about it here. And we have a good example. Last year, the European Union announced a cancer moonshot. I think they're trying to reduce the incidence of cancer by 50% by 2040. A very bold idea. But when they made their announcement, they publicly pointed out that we can't do it unless we end the tobacco epidemic. So they've actually set up a working group to figure out how they can do that.
Chris, I did want to loop back to you because I'd like to put a little more of that larger global context into this conversation before we wrap up, because I think it's important for people to realize that the U.S. should be leading on this. There are other countries that are now going to be way ahead of us if we don't get it together. And it's just, it's kind of shocking.
Yeah, great. And I'll just say that the U.S. has never really been a leader on this. It's U.S. states and localities that have been leaders on this. And I know I was there when we were negotiating the former Convention on Tobacco Control, and it was California code that they were bringing up as examples of what the treaty negotiators ought to be looking at. So it would be great if the U.S. was the example, but we certainly can't wait on them to do it. Just a brief synopsis of what's going on around the world. New Zealand was the first of the so-called Aspire countries. And back in 2010, they set a 5% prevalence goal by 2025. About 4 years ago, they realized that they weren't going to make it. They've already implemented everything in the Federal Convention on Tobacco Control. They've squeezed on enforcement. They've done everything possible, but Janet Hope and some of her colleagues were tracking it and realized they couldn't make it. And to their credit, they didn't change their goal. They changed their strategy. And so they went to Endgame. I'm going to juxtapose that with the United States. We are one of the Aspire countries. We had set a goal of 5% by 2030. And also, a couple of years ago, the U.S. realized it wasn't going to make it. So we changed the goal to 6.1%. So New Zealand is a hero of mine for that. They've decided we're going to do this. But there are about 15 other countries around the world that have set Aspire goals, 5% or less. Finland, for instance, is 2% by 2035. I know this Canada, Great Britain's, I'll say England separately, Scotland, Ireland, Wales, Norway, Sweden, New Zealand, of course, and I'm forgetting a couple of others. I'll point out too that after New Zealand's announcement, after this Parliament passed their world-changing bill, about a dozen countries said publicly that they want to look at what New Zealand's doing and follow them down that path. So I think we're going to see a lot more examples very, very soon. And my final comment would be that this has become totally normalized, more so outside the United States than in it. You cannot go to a regional or global conference that talks about tobacco without there being some sessions on Endgame. That was not true 5 years ago. 5 years ago, it was crickets. But now you cannot find one that doesn't have it. And I think when you look for the next national conference here, you're going to see the Endgame being front and center.
And I just want to add, why is this so urgent? Because I think there's some, there's a perspective, unfortunately, I think by many that, the tobacco issue is, largely solved in the United States, which of course it is not. And in fact, and we publish a report every year or so called Tobacco Nation, that if you look at those states that have the highest levels of tobacco use in our country, Um, our situation in terms of the numbers of people smoking, the impacts on their health, the availability of tobacco, the presence of laws that will help restrict access and availability, we are worse than some of the worst countries outside globally in terms of tobacco problems. We're as bad as Indonesia in some cases. I think it's a reframing that has to happen, that every place is not California or Massachusetts or states that have made incredible progress. That we literally have a country within a country that is as bad as some of those countries out, that we consider as having the worst tobacco problems.
But I think, like so many things, it's about have we created the right incentives? And I think, there is where having real leadership is going to be really important. Now, I know menthol was brought up earlier as one of the policies that we think really needs to be addressed. And I wonder if just briefly somebody wants to talk a little bit more about menthol, very important. And then I'm going to go around and just give everybody 1 minute to wrap up with last closing words.
In the US, FDA is all teed up to implement a rule to eliminate cigarettes with a characterizing flavor of menthol, and a companion rule to eliminate all added flavor cigars. And that would be a massive sort of, I consider that sort of pre-endgame things. That should get out of the way, and then let's focus on real endgame strategies. But it's all ready to go. We're hoping it'll be out in August as planned. But again, we have to keep the FDA's feet to the fire, not just to get to do that, but to follow up with all sorts of other endgame efforts as well. The industry is fighting it tooth and nail, and they brought up, as Robin mentioned before, this sort of crazy argument that somehow this FDA rule will cause police to enforce against Blacks and African American communities, which is nonsensical. The rule would only apply to manufacturers, distributors, and retailers, not to individual users, and so on. It doesn't provide police with any enforcement policies, powers, or anything like that.
The other problem with this is that every time, you ban menthol, and then you have all the new non-menthol menthol, and all the new non-flavored flavored, and all the new non-nicotine nicotine, and all the new non-tobacco tobacco. And it's just this endless proliferation. I mean, every week I get half a dozen papers about new products that the industry has developed and marketed to try to get around anything.
So it just shows that when we implement these endgame policies or pre-endgame policies, we have to make sure that FDA enforces against the manufacturers and makes them comply with all the other subsidiary requirements on them that are already in the Tobacco Control Act.
I think just to build on that, I think that quote unquote innovation that you see from the industry, creating non-menthol menthols, or I think Mark mentioned it earlier, other new products, nicotine products. That is why Truth Initiative is actually supportive of endgame policies applying to not just combustible products, but to all nicotine products. And I think that's really important. The industry, as I believe Eric said, the industry is going to fight all of these policies tooth and nail, and they're just going to keep introducing the next thing. And I think that's why it's so important to change the mindset that these products we don't need these products. We don't want to use these products, and the industry, as long as we allow them to, will just continue to put on more and more products. I mean, they're flooding the market right now with today it's disposable e-cigarettes, tomorrow it'll be oral nicotine pouches, and the next day it'll be something we don't even know yet. So, that's from our perspective, that's why it's really important to yes, we definitely need to tackle the combustible products, but we also need to be looking ahead and trying to stop the industry from this quote unquote innovation.
This is a great example of why we shouldn't completely depend on the FDA and why we need to keep their feet to the fire. Because when the 2009 Act was passed, menthol was exempted in the flavor ban, but Congress told them in that act, go look at menthol, and if it's a public health threat, move to ban it. They waited years, and we finally had to sue them. It was the African American Tobacco Leadership Council, ASH, National Medical Association, and American Medical Association had to sue them to get them to do their job, and they still soft-footed it for 2.5 years since the decision. So it's just another cautionary tale.
So one last minute for everybody to make a final point related to Endgame. We'll never wrestle this all to the ground at one time, and we've not even touched on some of the really hot button issues very much. But so I'll go first to Robin.
Sure. I'll just, I guess, end where I started, that, a tobacco-free future is possible. Endgame is possible. It starts with all of us and the circle of people that we all know and interact with every day, and then making it larger, adopting that, changing our own conversations, changing the way we talk about the tobacco issue, and believing that it's possible. And I think that we need to hold ourselves not accountable for what are the actions we're really taking to make it so. Obviously thinking in terms of endgame and not tobacco control, and starting to use that language and doing the work. If endgame is not the word ultimately for the consumers, which may or may not be true, let's do that research. I think we need to start educating policymakers, the larger public health community, beyond those that are just deeply involved in the tobacco issue, about what endgame is and what it isn't, what prohibition is and what it isn't. And holding, as you said, Ruth, holding the industry accountable and understanding where they are irreconcilably conflicted on this issue, where they cannot be part of the conversation, because their objectives are diametrically opposed. And then I would just say to, understand that and be prepared for those industry arguments, and to help governments and policymakers understand how to interpret that, and that for them to understand that these are policies that need to be done. It's not a silver bullet, but this is a suite of policies that need to be enacted over time, that will help us achieve an end to something that, listen, I'll just say it again, 70% of smokers want, nearly 60% of the American public, 57% in the CDC survey, said they want. We should listen to the people and give them what they are asking for.
I think we have a tremendous opportunity for strong endgame policies now because of what the tobacco industry has been saying. Because of all the pressure on them, we've got big manufacturers saying that they never want kids to use any tobacco nicotine product at all, and they want their smoking customers to quit all use or switch to less harmful products. We need to take that opening and push through just incredibly strong anti-smoking measures and youth protective measures, which would apply to all tobacco products, including e-cigarettes. Push that through, call them out on their hypocrisy. And the only way we can do that effectively is from developing a strong public health consensus about what are the 3 or 4 things that are most politically viable, most influential that we can do now to most quickly and sharply reduce the toll of death, disability, and disease and horrible economic costs from smoking and other tobacco use, while also sharply reducing the number of kids who get screwed up for life through becoming addicted to any tobacco product.
Sure. Let me talk a bit about the viability of the tobacco industry. And I think the public and even public health tend to think of tobacco as being a very heavily regulated product. I would argue it is the least regulated consumer product in history, given what it does on the market. If a new product came out tomorrow that was both addictive and deadly when used as intended, not only would that product be yanked off the shelves, the people that put it there would probably be tried or court. So they've had a free pass for 70 years. And just a brief story, when Luther Terry released the 1964 Surgeon General's report, he had the press conference on a Saturday because he was convinced that now that this information is so clear that we would have to ban cigarettes. And so he didn't want to wreck the stock market and give them one day to think about it before they panicked. And then nothing happened. It was business as usual. So they they're on borrowed time already. The industry needs to be made to go away.
This is an industry. It's that is, fundamentally predicated on a predatory addiction model that necessarily involves addicting kids. That is the business model of this industry, and that is just not acceptable. I think that is a place where we can start to build some consensus. They will play endless games, as Chris just mentioned. We tried tobacco cases against Philip Morris and R.J. Reynolds, and they tell the jurors that they are of the most regulated industry. They tell them that they can't do anything without approval from the FDA. They can't put out safer products because of the FDA. That's what they say in court, and they will keep playing these games. But as long as we have a mindset that fundamentally this is not an acceptable industry, and we have a mindset that we're not going to just manage the harm, that we're going to reduce it as much as possible to trivial levels, so that this isn't a enormous public health issue for the next several generations. I think, every state and every locality should be thinking about something on that Endgame menu that will work for them, and start there. FDA will do what FDA will do. They have enormous challenges in enforcing a large, slippery, and vast industry with thousands of players and millions of products. But at the state and local level, we can really do a lot to, I think, push them to do something on the national level, but more importantly, change the situation in our own communities and make them much healthier for future generations.
Thanks. And I'd just like to pick up on what Mark said in terms of working with communities. I think this is an opportunity for communities to, A, get started on the journey, as he said, and B, really work on those health disparities and breaking down some of the disparities that are related to tobacco and health equity, and ensuring that we are looking at all of these policies in order to protect those communities. So we need to work with those communities. But I think that that's what's so great about Endgame, is that it these policies are going to help level that playing field and ensure that everyone can enjoy the health benefits of these policies. And I think that it's really important to just be ready to change our thinking and get ourselves out of that tobacco control mindset and move forward.
I actually think that we're really at a tipping point on Endgame. And so it's up to all of us to make sure that we tip the right way. And now I'd like to go to my connection with Natasha Phelps, who wasn't able to join our live panel. Welcome, Natasha. I'm so glad that you were able to be here eventually.
Thank you, Ruth.
I want to go to you directly for, we've had some conversation about equity, and tobacco has always been an equity issue from the beginning, even before we had a tobacco epidemic. So it's certainly at the top of the agenda for the tobacco endgame. And I just wondered if you would give us a little more of your thoughts on that, because I know this is what you work on all the time.
All the time. Unfortunately, equity is still something we have to talk about. And yes, you're right. We can't talk about tobacco, especially tobacco endgame, without talking about equity, and equity being the driver of really the reason why Endgame is a good strategy is because if we look at the way that inequity structurally has worked in the United States and really globally, we look at the power dynamics at play, and how the important but frustrating process of regulating commercial tobacco products can be thwarted by these power dynamics, right? So, we take one step and sometimes we go two steps back because of the tobacco industry's litigation, or because a new administration comes into office and then the regulations change, or, we pass regulation, but there are these exemptions that lead to or sustain the inequity that we're trying to combat. And so the idea of approaching endgame strategies as the real focus that will kind of jump over all of these other hurdles that we've been dealing with in trying to pass these individual regulations is an acknowledgement of the inequity that we've been having to deal with. So the idea that we are acknowledging that local communities, that state governments and actors and advocates have a limited capacity, limited community capacity to be able to engage, limited resources to actually, get the community buy-in and the political support that you need in order to pass regulation. If we are acknowledging all of that, then what are we going to use that limited amount of power and capacity to do, right? And we want to be cognizant of the landscape that we're in and what can be achieved and what can't be achieved. But I think what we're seeing, in California, for example, is the start of communities, even communities and decision makers that have been hesitant to really take progressive movements for public health measures, to say, why do we keep coming back to this every couple of years? Why are we going to talk just about flavors? Why don't we just go ahead and get rid of the problem altogether, so that you're not bothering me, about this in another couple of years because the tobacco industry has come up with a new product that gets around it, or, a new product that is a similar but different issue. And so we're starting to see even those who may not in the past have been supportive of more progressive, protective public health measures like prohibition on the sale of all flavored products, like in Beverly Hills, for example, even though I know people don't always love to use California as an example, but I think it is a good indication that there are governments that are just kind of tired of having to go back to the drawing board and having to address the issues that keep coming up. And this is really important for equity, because equity and advancing health equity is always just about common sense. It's always about acknowledging the fact that the systems are what they are and the results are very evident. And when it comes to things like the abundance of evidence to support a ban on all flavored tobacco products, especially menthol cigarettes and little flavored cheap cigars and flavored e-cigarettes, people are just really kind of tired of having to say the same old. We don't need any more evidence. We don't need any more time. We don't need any more studies to show that this is harmful to health, that this is not something that people choose to become addicted with, that this is not a situation that is not preventable. It is preventable. And so why not just get ahead of it with some common sense endgame strategy, so that we don't have to waste government resources, community capacity, et cetera, and we can just get ahead of it and be done. So that's what I think the role of equity plays in the endgame work.
Yeah, that is it's a great way to put it, that this is actually using resources more effectively than what we have been doing in tobacco control, differentiated from tobacco endgame. But how do you address the issues of industry partnerships with, for example, minority communities that have been so long-standing? And I know there's been a lot of work to try to problematize those relationships, but the industry is still very powerful and still is reaching out to organizations and individuals that are influencers in the community. Do you have any thoughts on that?
Yeah, I mean, I think pointing out that those relationships exist is really important. I think it's hard because the tobacco industry is very well informed as to who's influential in marginalized communities. in marginalized communities, in civil rights and human rights movements, it's very difficult because there are so many problems. And so when you have a power player who's influential in one way, say to speak out against, police brutality, or to speak out against voting rights violations, who then also can be bought for the thwarting of protective measures like flavored tobacco products, like the tobacco industry has done with NAN and Reverend Al Sharpton's group NAN, for example. It's really difficult because, it's not that as a community, it's not that you want to tear down such an influential person who is necessary to the progression in all these other areas, but you do have to call it out because it is extremely harmful, like leading causes of death for Black people in all of these other ways. And so, not only calling out those relationships, but then calling out the farce of the industry and trying to play a role in racial justice, in social justice matters. It's really important to just let communities be aware of that type of permeation. And once I think, in our experience, once communities are aware of that type of relationship, they see what it is.
You earlier mentioned resources, and I think that's one of the key factors in actually saying we're going to approach Endgame from an equity perspective means shifting resources. And I wonder if you can speak to that and how, that's a question. So it means probably that some people who have gotten resources in the past may not have resources or as much resources, because some of those will need to be focused on the communities that are most affected by the tobacco epidemic.
Yeah, I think that that's an important conversation. It's also an important conversation to have buy-in on the shift, because that's not something that everybody is buying into, right? Some people think, listen, with the political environment that we have right now, we can't go full throttle. We just got all on the same page about this, whether it's Tobacco 21 or flavored tobacco policy or whatever. And, they just are thinking that it's not maybe the smartest move. In my opinion, I think the acknowledgement that the resources are becoming even more limited. So even those who have had resources to date, and the idea of an end game strategy might require shifting away from what they've been working with. My response to that is to think about how that might happen regardless, because there are so many issues that are coming up. We're having increasing actually public health problems, and we're looking at climate change, and we're looking at the issues related to infectious disease. That's not going to stop. That we're seeing a change in the political environment and the allocation of resources. Now is a time when people are thinking of investing in infrastructure and thinking about what could a new world look like, that we do kind of open our minds to how could we do things differently. And one of the ways to think about it, instead of like, why is, we are doing really good work in this community, why would I be okay with, say, the state funding going a different direction, or giving our resources, allocating it to something else? I would say that it's not necessarily that the resources aren't going to go to you and then you won't have any return on investment. I think that the return on investment to allocate resources to communities most impacted will be a return everywhere. And that is true when you're looking at health equity. If you are using people who are most impacted, have the most health impacts from certain policy decisions, and you choose to use those communities or those individuals with those certain health outcome identifiers as kind of the focus of policy development, resource allocation, it does benefit the general population. It benefits other people as well.
Thank you so much, Natasha. You've just highlighted some great issues that I don't think we'd completely covered in our live discussion. And there's no way we can have an end game with a healthy tobacco industry. And there's no way we can have an end game without really addressing the equity and social justice issues that underlie the epidemic. So thank you so much for joining us.
Thank you, Ruth.
And with that, I'm going to turn it back over to Robin to wrap up with any last remarks.
Thank you, Ruth, for leading such an important and nuanced discussion today on how we can move to end the influence of tobacco in our culture once and for all. I'd also like to thank Dr. Janet Hoke and my fellow panelists, Eric Lindblom, Chris Bostock, Mark Gottlieb, Natasha Phelps, and Stacy Gagosian for joining us here today and sharing your thoughts, your experiences, and your insights on how we can work together to advance the Endgame strategy. And finally, thank you to everyone who joined us here today. I really hope you found this conversation enriching and enlightening. As we've heard today, some endgame policies are within our grasp right now, and some will take longer. But it is possible, it is achievable if we're willing to adopt a new mindset to end tobacco for good. And lastly, to learn more about Truth Initiative's endgame policy and get involved, please visit us at truthinitiative.org. Just want to say thank you to Ruth and our entire panel for being here today.
Thanks so much for having me and for the great participation from my panelists.
Thanks, everyone.
Thanks, everyone, for joining, and thank you especially to Truth for hosting this.
Thanks for having me. It was a great discussion.
Thanks so much.